Welcome to the lecture on forensic psychiatry. This is the first part of forensic psychiatry. I have divided this class of forensic psychiatry into 4 parts. This is the first part. I am Dr. Sanil Kumar MC, working as professor and head of the Department of Forensic Medicine, Government Homeopathic Medical College, Kozhikode. First, we will learn about some definitions like psychiatry, forensic psychiatry, mental illness, etc. So, psychiatry deals with the study, diagnosis, and treatment of mental illness. We have to study mental illness, we have to learn how to diagnose mental illness, and finally, we have to learn about the different treatment modalities of mental illness. That comprehensive study is called psychiatry. As far as forensic psychiatry is concerned, the forensic psychiatry deals with the application of the knowledge of psychiatry in the administration of justice. So, forensic psychiatry deals with the application of the knowledge of psychiatry in the administration of justice. Now, about the term mental illness or unsoundness of mind. This is defined as a disease of the mind or the personality. So, a person's mind can be diseased or his personality can be diseased, in which there is derangement of the mental or emotional process and impairment of behavioral control. So, the term mentally ill or mental illness is used for those persons who are unable to adapt themselves to the ordinary social requirements due to mental diseases, and the law is most frequently concerned with mental impairment and not mental illness. Now we have to learn who is a psychologist and who is a psychiatrist. So a psychologist is a person without medical qualifications, and he has a degree in psychology, and the concerned area of a psychologist is the study of normal and abnormal mental functioning, usually by means of test of intelligence, test of personality, etc. So a psychologist is basically a person without a medical degree, and a psychiatrist is a person with a medical degree, that is after a medical degree or basic medical degree like MBBS, BHMS, etc. he will be learning psychiatry as a specialty subject. So that is the difference between psychologist and psychiatrist. A psychiatrist can treat mental illness with medicines, but a psychologist has to treat a mentally ill person using counseling and other means without drugs. Now we have to learn who is a mentally ill person. A person who is in need of treatment by reason of any mental disorder other than mental retardation is called a mentally ill person. So a person with a mental retardation is being excluded and he is not considered as a mentally ill person. All other mental disorders other than mental retardation and a person who is having this mental illness and is in need of treatment is called a mentally ill person. And in Indian Lunacy Act 1912 is defined is having a term called lunatic, and lunatic is defined as an idiot or a person of unsound mind. Now about the term forensic psychiatry. So forensic psychiatry is involved to determine the responsibility of crime. So if a crime is being done by a mentally ill person or alleged person who is mentally ill, the court has to decide upon the criminal responsibility of that person. So in this the help of a psychiatrist to determine whether the person is mentally ill or not comes into place. So to determine responsibility, criminal responsibility of crimes, and sexual psychology in case of rape and other sexual problems such as homosexuality, transvestism, pedophilia, that is habitual sexual intercourse with children, fetishism, etc. And forensic psychiatry is also involved in competency in contract actions, competency to testify or give evidence, then ability to give informed consent for treatment, competency to stand trial, competency for testamentary capacity, and malingering, etc. These are the areas where forensic psychiatry is applied or involved. Now about the duties of a medical officer. So a medical officer may be asked to give his opinion on the state of mind of the accused at the time of committed offense, and he may be asked to comment on the present state of the person awaiting trial if he is competent to stand trial, etc. So if a medical officer is asked to give his opinion, it is caution not to venture his opinion in the court of law without fully understanding the full implications of his opinion expressed and the bearing it has on the social, legal and moral issues involved. So we have to express caution not to venture our opinion in the court of law, but we can give a closed remark in a envelope. Now, some interesting symptoms of mental illness. First one is first one is delirium. So delirium is basically disturbance of the consciousness in which the person's orientation is impaired and the critical faculty is blunted or lost, and because of that, the thought content is irrelevant or inconsistent. So delirium basically occurs in physical diseases in which there is continuous high temperature and sometimes due to overwork, mental stress or drug intoxication. So in case of delirium, a person may become impulsive and may become violent and also may commit suicide, and such a person is not responsible. So a person in delirium is not responsible for his criminal act. Next about delusion, and delusion is a false belief in which uh, he believes in something which is not a fact, and the belief persists even if its falsity has been clearly demonstrated. And delusion is a sign of psychosis since it represents a defect in reality testing, and delusion is a mere indication of a deep-seated mental disorder. And a person who commits a crime during delusion is not fully responsible for his criminal acts. There are different types of delusion, like delusion of grandeur or exaltation, delusion of persecution or paranoid delusion, delusion of reference, delusion of influence, delusion of infidelity, delusion of self-reproach, delusion of nihilistic delusion, hypochondriacal delusion, and other types. We will look into one by one. Nihilistic delusion means the person believes that there is no world, he is dead, etc. And in case of hypochondriacal delusion, the person believes that he has an incurable disease like cancer, AIDS, etc. Then in case of delusion of poverty, he thinks that he is very poor even though he is very rich. In fact, in the present condition, he is very rich, but he thinks that he is very poor. That is called delusion of poverty. Then there is delusion of grandeur, in which he believes that he has divine powers, untold wealth and approach. Then delusion of sin means the person thinks that he has committed some sin. The delusion of guilt means that he considers himself to be guilty of a particular act. Then there is delusion of self-accusation, in which he believes that he is being accused of a particular crime. This is a picture depicting a delusion of grandeur. A cat thinks himself as a lion. Then here in this picture we can see that Obama thinks himself as a Superman. There is delusion of reference, in which the patient things that he is being referred to in talks on TV shows, etc. And delusion of being influenced means person thinks that his ideas are being influenced. Delusion of jealousy means the person becomes jealous of somebody for no reason. Then delusion of fidelity means the person suspects the fidelity of his wife, and in due course he may assault her or try to kill her. And delusion of persecution means that the person person with this type of delusion thinks that attempts are being made to kill him, usually by close relatives like children, his wife, etc. These are some of the Malayalam films that depict delusion, that is delusion of infidelity. Now we have to learn a term called erotomania, and this is a type of delusion in which a person believes that someone is in deeply love with him or her, and this erotomaniac person develops an obsession for the person and starts believing that the other person is reciprocating his love. Then usually the opposite object, or the lady or male is of a higher status. He may be famous, or he may be superior at work like a boss, and sometimes he can also be a complete stranger. It's called erotomania. This erotomania has been a subject for a lot of Indian films in Bollywood, Tollywood, etc. Another term usually dealt in psychiatry is hallucination. So hallucination is a false sense of perception, and this false of sensation is without any external object or stimulus to produce it. So for sensory perception, we have to experience a particular stimulus, and in case of hallucination, there is a false sense of perception that is without stimulus. There are two types of hallucinations, like hypnagogic hallucination and hypnopompic hallucination. Hallucinations that are occurring while a person is falling asleep is called hypnagogic hallucination, and hallucinations that are occurring while a person is awakening from sleep are called hypnopompic hallucinations. And hypnagogic and hypnopompic hallucinations are not true hallucinations. Now about the types of hallucination, there is visual hallucination, auditory hallucination, olfactory hallucination, gustatory hallucination, tactile hallucination, and finally sexual hallucination. So visual hallucinations means he sees different colors, or he sees flashes of light, and this type of visual hallucination is normally seen in diseases like epilepsy, temporal lobe epilepsy, and drug dependency. The next type of hallucination is auditory hallucination, that is, he may hear sounds like beating of drums or ringing of bells, etc. This is seen in diseases like schizophrenia, organic mental disease, severe depression, etc. Olfactory hallucination means smelling of a particular thing, and this may be seen in temporal lobe epilepsy, schizophrenia, etc. Gustatory hallucination means he experienced taste of a particular thing. Then tactile hallucination means the feeling of insect or sands of skin, as in cocaine poisoning, which is referred to as Magnan's symptom. Then in case of schizophrenia. And sexual hallucination means increased libido, or English sexual desires. Now about a term called illusion. Illusion is a false interpretation of an object or stimulus which has a real existence. So what differs from hallucination is, hallucination means there is a false sense of perception, and in case of illusion there is a false interpretation of an object which is having a real existence, but the person is interpreting falsely as another object. Example, sometimes a man sees a dog and he mistakes the dog for a lion, a rope for a snake, a tree for a ghost, a bird's note for a human voice, etc. So basic problem is in it is a false interpretation. And illusion is not a sign of insanity, and normally illusion can be removed by reasoning, argument, or showing a mistake in a normal person. This is one of the famous illusion. If we concentrate in the plus sign here for a few seconds, we see that these pink dots or balls disappear, and if we remove our focus from this plus sign, the pink balls reappears. Hope you all have understood or seen this illusion. This is another classical illusion where if we concentrate on this picture, you can see a wave-like motion passing from here to here, or from here to here diagonally. If we search in Google, you can see a lot of illusion like this. Here is a classical illusion in which there is a bottle, and we can see a picture here. In the first impression, we can see that this is a lady and a man or a person is hugging her from behind. But on close inspection, you can see this is a fish, this is another one, this is another fish, this is another fish, this is another fish, here also another fish, here also two fishes, and altogether we are experiencing a different view. So there are persons who can distinguish this picture as a school of fish, or two persons hugging each other. This is another picture which is or illusion in which we can see that bottle is being projecting out. Actually, this is a stick which is sticked on a container, and from a particular angle this bottle seems to be projecting out. This is another illusion where you can see different hoses in this picture, and you can count the number of hoses that is present here. There is one, here there is one, here there is one, here there is one, and here there is one. So a total of 4 or 5 hoses can be easily picked out. This is another illusion which is called Thatcher effect. That is, while viewing this picture, we don't experience anything strange, but if we see the picture upside down, this is the result. So in the first picture, this picture was seen upside down, and we didn't feel anything strange, but on keeping the picture upside down in the second picture, we can see that the lips have been turned upside down, and also the eyes have been turned upside down. This is called Thatcher effect. You can see this in this picture. In the top two pictures, we will not be experiencing anything. If we turn this picture upside down, this is normal, but this is abnormal, because the eyes here are normal, but if it is turned upside, if this picture is turned upside down, you can see that the eyes are actually turned upside down. In this picture, we think this is normal. Also, the lips are turned upside down. This is called Thatcher effect. This is a street art. Usually, this type of street art are done in street of European countries by artists. Now coming to the term called impulse. So impulse is a sudden irresistible force compelling a person to do the conscious performance of some action without motive or forethought, and usually impulses occur in epilepsy, dementia, and in case of acute mania. There are different types of impulses like kleptomania, pyromania, mutilomania, dipsomania. Sexual impulses including sexual perversions, and lastly suicidal impulse and homicidal impulses. Kleptomania means stealing of articles of little value. Pyromania means setting things to fire, and mutilomania means maiming of animals. Dipsomania means drinking alcohol or alcohol drinking habit. Sexual impulses including sexual perversions are considered as impulses, and suicidal impulse, and finally homicidal impulse. Another term we had to come across in psychiatry is obsession, that is a single idea, a single thought, or a single emotion constantly is being entertained by the person, which he recognizes as irrational. He thinks that he is irrational, but even after lots of effort to drive it out of his mind, this irrational single idea, thought, or emotion persists in his mind. Example, a person may have bolted the door, but he keeps on checking throughout the night again and again whether he is bolted the door or not. Now the term called phobia. So phobia is an excessive irrational fear of a particular object or a situation. Then affective disorder is a psychiatric disorder in which the chief feature is relatively prolonged affective change of an abnormal degree, and this may be seen in case of mania, depression, etc. There are different types of phobias like agoraphobia means fear of open spaces, claustrophobia means fear of closed spaces, nyctophobia means fear of darkness, acrophobia fear of height, hydrophobia fear of water, phonophobia fear of sound, photophobia fear of light, pathophobia means fear of disease, toxiphobia means fear of being poisoned, thanatophobia means fear of death. Another term is called lucid interval. So lucid interval is a period occurring in case of insanity during which all the symptoms of insanity disappear completely. And sometimes lucid interval is also seen in head injury, especially extradural hemorrhage. And the medical legal importance of lucid interval is that during this period, that is during lucid interval, the person will be held responsible for his criminal act, but it is very difficult to confirm whether he is in lucid interval or not. Now, what the difference between lucid interval in case of insanity and head injury? In case of insanity, there will be a history of insanity present, and in head injury, there will be history of head injury. Normally, in case of insanity, there will be preceding symptoms of insanity before this lucid interval, and in case of head injury, there will be preceding symptoms of concussion before lucid interval. Then in insanity, in true insanity, after lucid interval, it is followed by symptoms of insanity, and in head injury, after lucid interval, it is followed by symptoms of cerebral irritation and compression of brain due to the hemorrhage. And insanity, lucid interval, the occurrence is very frequent, and in case of head injury, it may occur only once. Now another term called mental retardation, and mental retardation is being judged by a test called Binet-Simon test, and this test is used to find out the intellectual capacity of a person known as the intelligent quotient, or popularly known as IQ, and the intellectual capacity is estimated in relation to the chronological age, and it is expressed as percentage, and the normal test percentage or normal IQ is ranging from 90 to 110, and IQ is being calculated by the formula mental age divided by chronological age into 100. So MA means mental age and CA means chronological age. So mental age divided by chronological age into 100 gives our intelligent quotient. So after calculating intelligent quotient of a person, we can classify him whether he is having mental retardation, and the three types of mental retardation are there. Normally 90 to 70% means feeble minded, and if the IQ is between 70 to 50, we can consider him as a moron, or he is having mild mental retardation. If the IQ is below 50 and ranging to 30, he can be called as imbecile or moderate mental retardation. And in case of idiot, the IQ is less than 30. In some textbook it has been given as less than 20. This is a severe mental retardation. And we are coming to the end of this session, or the part 1 of forensic psychiatry, and the topic discussed were definition of psychiatry and forensic psychiatry. What is the role of a registered medical practitioner in forensic psychiatry? We learned about the different terms used in psychiatry like delirium, delusion, illusion, hallucination, impulse, obsession, phobia, lucid interval, etc. And finally, a word about mental retardation or IQ, which is calculated using the formula Binet-Simon test. Thank you.